Good afternoon. My name is Tim Caddigan, and I'm the chair of the board for the Oakville Chamber of Commerce. Welcome to this webinar, our fourth in the COVID Conversation series. We are pleased to have the Canadian Medical Director for Teledoc Health, Dr. Hanif Jamal, and longtime partner of the Chamber Network, Brett Tanner, who is the Regional Marketing Director for the Johnston Group. Physical distancing has impacted our normal chamber operations, but we remain committed to finding new and innovative ways to engage with our members. Here at the Oakville Chamber, we thank you for taking the time to discuss some of the important issues facing our country during these unprecedented times. So on that note, let's jump right in. Dr. Jamal, welcome. I want you, if you can, to give us an overview of what virtual care and telemedicine is.
Thanks, Tim. Well, to put it simply, virtual care and telemedicine are simply alternative ways to communicate with your healthcare provider using your telephone or video. So instead of going physically into your doctor's office where they conduct an exam, you use your screen to communicate with your physician and hopefully work on a diagnosis, potentially get a prescription, and develop a care plan just like you were physically there. The term telemedicine is kind of a legacy term before the video capabilities were, common. I often joke that, Teladoc's been around since 2002. So this isn't really a new technology, but we're now using the term virtual care a little bit more than telemedicine, but they're kind of synonymous.
So the video aspect would be one difference that I'm picking up on, but I'm curious about how this differs from the Ontario telehealth system.
So there's a lot of similarities. I think that it's difficult to compare and contrast. We both have Canadian trained and certified physicians on the platform. Because we're a global network, I think that where it differs is our patients that use the Teledoc platform or members of the chamber plan, for example, are able to continue to use the telemedicine platform when they travel to the States, which of course the OTN service does not offer. So if you're a snowbird, again, talking about traveling is kind of sad right now, but if you're in Florida and you forget your prescriptions, for example, you can call on the Teledoc app, and what will happen is it'll transfer you to a state certified physician in that state to prescribe the medications if necessary. So there are some differences. Our network, we have our own layer of quality control, if you will. So there's, of course, the college guidelines and best practice guidelines, but layered on top of that, Teledoc has their own virtual care clinical practice guidelines. And since we've been doing this for a long time, we've invested a lot of time and research into making sure that our patients get a very safe and appropriate assessment, because as you know, not all things can be treated virtually, and some things can very well be treated virtually, and many physicians don't even realize that as they are new to adopt virtual care into their practices.
So we're having this conversation right in the middle of the COVID crisis. How has a global pandemic changed the way Canadians are accessing virtual medicine?
Well, I'd like to commend the federal government and the provincial government because they are urging Canadians to use virtual care as a first line. Of course, 911 is the first line, but in terms of semi-urgent and non-urgent issues, they're encouraging physicians to avoid emergency rooms and avoid walk-in clinics and avoid their busy family practice offices, waiting rooms, and choose virtual care. And in addition to that, they've made it easier for Canadian physicians to start adopting virtual care, namely giving a billing code associated with certain types of virtual visits. So I think that it's really, really helped speed the process along. I joke that many years ago, my parents were afraid to use their banking app. They were scared about security. They were scared about where's this money going to go. Definitely not comfortable taking photos of checks. And I think that's where telemedicine was in Canada, maybe even just 6 months ago. And I think we've really fast forwarded that as the pandemic has taken over. And physicians and patients are realizing that avoiding physical contact, especially in a sick waiting room, is preferred. And of course, you're in the comfort of your own home.
So I don't want to put you on the spot. I know that you are with Teledoc Canada, but I'm curious about how Teledoc is operating really across the globe. We're hearing obviously over the last few months so much, and we know more about how countries are responding to the crisis. So what role is Teledoc playing in other areas?
Well, no, that's a great question, and I think one of the great features of Teladoc being a global company is virtual care has no boundaries. And we have medical directors in China, we have medical directors in Spain, and we have these conference calls across the globe. And I'm able to pick the brain of the medical director who is managing Asia right now. And we were able to kind of upstaff our physicians and get prepared here in Canada, because we were in contact since December, hearing about how difficult it was over there, the volumes, the surge in adoption of virtual care, then speaking to our colleagues in America and seeing what's happening in New York. And then the medical director of Spain would chime in and talk about what's happening there. I'm especially interested in what's happening in New Zealand, and we have our medical director in that part of the world kind of sharing ideas as to how they are coping. So in addition to being a virtual care physician, being a practicing physician, actually, I live in Oakville and work at Oakville Trafalgar Hospital for the last 14 years and have a family practice in Oakville. So, it has helped me in my personal practice as well, having a network of global physicians connecting together, sharing ideas, sharing best practice guidelines. We're hearing cases out of China and how they were treating the patients over there, and then disseminating that information to our Canadian virtual care doctors has been a real advantage of the Teledoc network for me as a Teledoc doctor, as national director, but also as a clinician treating patients in Oakville, sharing stories about patients' lack of smell, and how that is a sign of COVID. Patients that have unique rashes or diarrhea, for example, and how that was commonly described on a virtual care consult in Spain. And I was able to share that into my practice here a little sooner than perhaps others because of that global communication.
I find that really interesting because I have to admit, when I first started looking at Teledoc, I had pictured it more in a sort of a siloed environment. So the sharing of information is obviously a benefit. Can you, based on those conversations you've had, can you compare Canada's response to what other countries are doing?
That's quite a political question. I think that obviously we have more access to phones, to good Wi-Fi network, to phone lines that have good data plans. And so more Canadians are able to access using a virtual sort of medium. And in other countries, unfortunately, they just don't have the access, and the population is very different. So in countries like us, where we have electronic medical records, we have information sharing as a baseline infrastructure, we have virtual care in its infancy prior to COVID, we're able to flip a switch and really rev up on our virtual care offering. And other kind of first world countries are able to do that as well. But what's interesting to note is that countries in Africa are very high tech as it relates to healthcare. And the reason for that was they didn't have a healthcare infrastructure prior, and a lot of the government agencies and NGOs have invested a lot of money in healthcare technology to access for different African countries where there's patients in very remote areas where their cell phone is their only means of communication. So it's interesting that areas like that are quite well equipped because they never had a healthcare system like we had here, and they're starting from scratch, and they're building it with a kind of a virtual mentality first.
Okay, we'll come back to that a little bit more on the system itself. Brad, I want to turn to you. One of the biggest benefits to the chamber membership is access to the chamber plan, which is administered locally by the Hanif Financial Group. Who on the chamber's plan is eligible for the services, and what is the cost?
Well, thanks for the question, Tim, and thanks to the Oakville Chamber for putting this together. On September 1 last year, the Chamber Plan added the Teledoc service to every firm with extended health coverage on our program. So the Chamber's plan at Teledoc were the first virtual healthcare partnership offering on a group benefit plan in the country. And uniquely, there's no cost to the insured firm.
So following up on that then, how can individuals access Teledoc Health's telemedicine services as plan members?
Yeah, so each employee insured on the Chamber's plan has access to our employee resource site called My Benefits. Basically, a portal where they can manage their own benefits internally. Employees can simply follow the Teledoc prompts through there, or they can separately download the Teledoc Canadian application from either the App Store for Apple or Google Play for Android devices. From there, you simply provide the information set up on your account with information from your Chamber's plan certificate of insurance. Once it recognizes you're from the Chamber's plan and you click into that area, it'll ask you a few basic medical questions, like you might see when you go to a walk-in for the first time. And then you'll be live and able to schedule a visit within a couple of clicks.
Thank you. So if you've just joined us, my guests today on COVID Conversations are Dr. Hanif Jamal, the Canadian Medical Director for Teledoc Health, and Brett Tanner, who is the Regional Marketing Director for the Johnston Group. Dr. Jamal, the importance of this type of innovation in healthcare is highlighted at a time like this. Can you share in more detail the advantages of using Teledoc Health's telemedicine services, not only for the patient, but for the overall healthcare system?
Oh, that's a great question. I kind of touched on that a little bit earlier, but I think the key is to Teledoc is that we're working alongside the healthcare system. When we were designing the offering in Canada, it was very important for me that we did a lot of research, speaking to boots on the ground physicians, spoke to patients, and obviously, working in Canada, all my career for the past 14 years, it was important that we looked at what the need in the system was, and we were able to meet the need. And it was very important for us to have a system where we share information with the family doctor. We plug information back into the system. We make sure that patients that have primary care physicians, we are not having them call us and change the game plan or change the care plan to a point where it would upset the primary care plan. So we're very cognizant in how we were building it. Ultimately, if we're able to take pressure off the healthcare system, and which is completely evident right now during this pandemic, more Canadians are going to be able to access the care that they need in a timely fashion. Working at the hospital locally, we see the number of patients who are having ER visits dramatically down, which you would think would be the opposite. But in fact, patients are able to access care through virtual care mediums, and they're able to be triaged instead of going to the emergency room. And the patients that are triaged and feel that the doctor feels that they need to be admitted to the hospital or go to the hospital, it's that they really need it. And so feedback I've received from physicians working in the hospital, and I mean, I do work there as well, is that the patients that are admitted are sick. They are definitely in need of medical care. And some of the fluffy admissions and the fluffy admits and visits are avoided because the patients are able to, call up Teledoc at 2 a.m. on a Sunday and determine if their child has a rash that's concerning, or if their, ankle is actually broken, or if they have something that's concerning. And if you wanted to bring it back to COVID, if the symptoms they're describing is concerning or concerning enough that they require a blood test or an oxygen test. And the physician on the line at those hours are able to help avoid a lot of those emergency room visits. So I think we're seeing quite clearly in Canada and internationally that services like Teledoc, where patients have access 24 hours a day, 7 days a week, to Canadian trained physicians, Canadian certified physicians who are actually working in the provinces and licensed in the provinces where the patients are, is a huge asset. I kind of joke sometimes that, a patient calls Teledoc and gets me on the line and they live in Oakville. I would be the same type of person who would be seeing them in the emergency room, except they'd have to wait a lot longer. And so I think the emergency room colleagues appreciate a triage by a trained physician. And of course, the patients like it as well. One thing that I often find is, Teledoc serves as the tiebreaker. So, if it's 3 o'clock in the morning and there's a spouse, there's a husband and a wife, and the wife calls and says, I really think my husband's having concerning, symptoms. I want to encourage him to go to the hospital, but I wanted to call Teledoc first. And the husband often says, oh, it's nothing, everything's fine. And then we kind of play kind of tiebreaker, as I said, and and give a suggestion to say, this is perhaps concerning, for example, and you do need to go to the emergency room. And then that patient packs up and goes to the emergency room, and they understand that although they're waiting a little bit, it's a necessary visit. So I find that that's one of the added benefits as well to work alongside the healthcare system.
So how does that handoff happen? You've had a conversation with the patient. You've determined that it's probably best for them to go to the emergency room. So they go to the ER. Are they provided with documentation? Are you in contact with that ER? How does that handoff happen?
It's a good question. So it varies from province to province and city to city. Oftentimes we empower the patient to ask what type of communication they would like. Oftentimes their privacy is, it wants to be preserved and they don't want us to share that information. But if they do, I've had physicians call the emergency room. We certainly have the capability to fax over the encounter to their healthcare provider, or whether it means, making sure that they're calling 911 and calling an ambulance and having us on the line and potentially even speaking to the ambulance driver. I haven't had an example like that, but I can foresee that being utilized as well. So it was very important for us, as I mentioned, that we have a way to communicate with the primary care network by faxing or calling.
Right. I would assume that you've seen a tremendous increase in demand based on how many GPs are not available, and that I think you called it a fluffy appointment, but regular appointments with their GP may not be possible right now. What has the demand and increase meant for you?
Oh, it's just to put it in perspective, I think, pre-COVID, we had about, 4,000 visits a day in North America. And now at our peak, we were at 20,000 visits a day in North America. I think right now it's averaging around 15,000. So it's a tremendous increase in volume that we're seeing.
So, obviously we're dealing with this as a medical service, a medical issue, but from a business perspective, how was that whole process in scaling up? That's a tremendous increase in demand.
Yes. I can speak to Canada only. I'm not too in the loop with regards to the rest of the world. However, from our perspective, we started to hire physicians early. We were well prepared for this pandemic. Like I said, we were speaking to our colleagues across the world, and we were able to understand that this was likely going to be a big issue. And we started recruiting very early. I'm happy to report that it wasn't difficult finding physicians. I'm having physicians email me, LinkedIn me, text message me, saying they're very interested in looking into virtual care more than ever. So I think we were actually over prepared in Canada, which is a blessing.
That's good. At the Oakville Chamber, we're always looking ahead at what the future of business looks like. And I think we've had daily conversations around what it means to various types of businesses. I hadn't really given a thought to healthcare. So as a Canadian healthcare leader, can you give us your thoughts on what the future of healthcare will be as we come out of COVID-19?
I think that we're going to be much better off once this is over. I think that it's a tough question, but the learnings from this pandemic are going to be lasting. I think that we've shown that we have grit, we have perseverance, we have bravery. I know when I walk around the hospital and I look at my colleagues, I feel like we've just gone to war together. I reflect back on World War II and many of the other wars, and how from those kind of tragic events, there was a lot of health technology and innovation. And from that, we benefited in the healthcare system. And I think that a lot of the things that we are learning from this pandemic, a lot of the emergency preparedness, technology, and how we can better assess patients, how we share things across the province, are all going to be here to stay. I can tell you that during this pandemic, we've had so many town hall meetings between multiple physicians, information sharing, things that we never did before. And so I think that this has brought us all together because we're fighting this all together. And it's only going to be here to stay, because once you start communicating this way, you can't really go back. And once you see that it's so effective, I think that it's really going to be really exciting for how we communicate and how we information share and how we prepare for this. I think Canadians are going to be acting differently. I reflect back on the SARS days, and after SARS, we now saw hand sanitizers everywhere. That was a normal sort of occurrence in grocery stores and hospitals, and it wasn't there prior to SARS. I think after COVID, we're going to see, masks being used more commonly. I think that we're going to at the office place when someone has a mild flu or the sniffles or sneezing, they're not going to just stick it out at work. They're going to understand that it's important for them to be home. Their colleagues are not going to look at them with the stigma. I think that if you don't cough in your elbow, you're going to be looked at the same way if you don't throw a pop can in the right recycling bin moving forward. So it's gonna definitely be a change for the better. I also feel that we'll have a new respect for viruses like the flu. So when flu season comes, we'll be better prepared. We'll understand the importance of social distancing if you're unwell, and we're just going to be washing our hands a lot more, which is something that we all talked about before, but we never really implemented on a grand scale. So I think this is only going to be upside.
It's interesting the notion that you're talking about, the changes as we come out of this. What do you see changes that the ministry may make with respect to allowing patients to have doctor visits by video or phone? What will this crisis bring to Teledoc and to the ministry in general with how patients are treated?
Well, it's a tough that's a tough question because we don't know. Prior to the Ontario government releasing those billing codes, they did have a little asterisk next to it and said, we will reassess this after the COVID crisis is over. So I think there's going to be a lot of data collection. I think they're going to look at the cost of providing virtual care in this fashion, what it's going to mean for the healthcare system. Personally, I think that the checks and balances as it pertains to security is going to be a big issue. To me, I'm astonished that doctors are, allowed to use FaceTime or WhatsApp or Zoom to be able to communicate with patients. At Teledoc, I think we take privacy and security so seriously, and we've spent so much time and invested so much energy into ensuring that, the data is stored in Canada, the encounters are not recorded, and the patients feel we're following PHIPAA guidelines. And so I think that once this is over, the ministry is going to hopefully relook at the mediums in which patients and doctors can communicate, and adding in a lot of checks and balances to make sure that the data is safe and patients feel secure just like they do when they have an in-person encounter.
You mentioned that you also work at the Oakville Hospital, and I'm just curious how the mood is. How are your colleagues handling the threat and I guess the scary prospects of even going into work?
Well, that's a good question. I can tell you from the physicians that I speak to, the mood is good. I think that we are very well prepared. We had a lot of emergency planning, and we had a lot of emergency preparedness conference calls. And I think that it's just similar to Teledoc. I think we were over-prepared, and we're ready. We have physicians ready to work, and we don't need them yet, which is really, really exciting. And I think another thing to comment on, I'm on the board of directors for the foundation, and I can say that the outpouring from the Oakville community in terms of donations, in terms of offering to give food to the hospital has been, it literally brought a tear to my eye, and to many members of the hospital at how generous the community has been in offering support, whether it's donating ski goggles from a local ski shop to donating N95 masks from local businesses, and an outpouring of food being delivered all the time to the healthcare workers and the frontline staff, right down to the cleaning staff. Everyone's getting fed really well at the Oakville Hospital thanks to our community support. So I do like to say thank you to everyone for that as well.
So you've opened that window, and I have to ask, are there any other things that businesses can do, any other support from the community that the hospital would benefit from?
It's tough for me to say as an individual physician. I know that the website for the Oakville Hospital and Halton Healthcare does kind of outline what are the key needs right now and ways in which you can donate to the hospitals. And I think it's also important to know that long-term care facilities and other healthcare facilities that are not as recognized, they're not as popular, if you will, as the hospital, also need a lot of attention. So to be aware that, there's all aspects of health has been affected, from the hospital right down to long-term care and primary care community health centers.
I didn't mean to put you on the spot, but it is good to have a voice that's so close to the front line. So on behalf of the Chamber, thank you for everything you're doing.
You're welcome.
Brett, we've had a great overview of Teledoc Health's telemedicine services. What are some of the other benefits and resources provided by the Chamber's plan during the pandemic?
Well, the Chamber's plan has provided its members with significant flexibility to help them through this difficult time. So first of all, there are many relaxed rules, and you have to understand the insurance world is full of rules and regulations, a very rigid sort of industry, which we've relaxed several to allow firms more flexibility with employees laid off, whether they've elected to keep benefits or suspend them, and bring them back later. The plan is returning 50% of dental premiums and 10% of extended health premiums for April, and continuing to monitor and provide reductions as required. Probably by mid-May, we'll make a decision on the May premium, but it's probably going to be something very similar. The refund includes firms who have actually terminated their coverage for May 1st. So we're still helping those, even those that have shut down their programs. We've removed some short-term disability waiting periods and allowed firms any laid off employees could be brought back within 6 months, and those also that suspended benefits at previous rates and levels of coverage without any underwriting. Firms have also been given extended payment options as well. The Chamber Plan is a not-for-profit support program that provides many additional resources at no charge, and a lot of them are being used during this pandemic in excess of normal sort of usage. The Business Assistance Service, for example, provides 9 hours of accounting, legal, and HR help to all insured businesses, and the Healthy Business Bookmark a whole slew of HR resources, from articles to templates, videos, links of HR-related material. The plan has also developed a microsite, covid19.chamberplan.com, that has additional resources from things as basic as how to work from home, how to be an employer with employees working from home, to government programs for individuals and businesses. It's loaded with useful information, and I encourage plan members to take some time in there taking a look. And during this time, I encourage anyone with the Chamber's plan, if you have any questions or concerns or need help with anything, please reach out to your local advisor for assistance. They're best suited to look at your individual coverage and advise you accordingly. And again, in Oakville, that's Hanif Financial.
Perfect. Thank you, Brett. And thank you, Dr. Hanif Jamal, for joining us on COVID Conversations. We appreciate the time that you've taken out of your busy schedules for what we believe was an important conversation on virtual medicine in a pandemic lockdown. Thanks to everyone for tuning in. We'll be back next week on May 6th for another edition.
It's no surprise that Oakville was ranked the #1 place to live in Canada. In this town, business happens on a global scale. From automotive, tech, manufacturing, and small business, Oakville has it all. This is where innovation happens and ideas ignite. At the Oakville Chamber of Commerce, we don't sit back and wait for things to happen. We accelerate economic growth. And we do it by creating opportunity, championing excellence, investing in the future, and collaborating together. We helped shape this town, and we did it by pouring energy into this community, because we believe that a thriving business community benefits everyone. The economic forecast in Oakville is bright. So, what does it mean for you? It means more resources, more opportunity, and more success. We are a passionate people, and we are ready to help. Become part of our community. Be seen. be heard, and belong.